Today I'll be speaking to you on the challenges that I've experienced in public health dentistry and navigating these challenges. Specifically, I'll be speaking on some of the barriers to oral health care and the role that I believe the community dental health coordinator can play in mitigating some of these barriers. I'll start by introducing myself a little bit. I was born here in the US, but when I was about 5 or 6 years old, I moved to Ghana, and I lived in Ghana, West Africa, for about 10 years. I moved back to the US and applied to this wonderful college, and I spent the next 4 years in Brunswick, Maine. My experience was fabulous because it basically set the trajectory for my current professional experience. There was a class in sociology that I took that really helped me think about health in a different way. Prior to taking this class, I had always thought about disease as being caused by a virus or bacteria. But in this class, I recognized that as the public health field would describe it, there are social determinants of health that also impact our health. Economic instability, distance from the health care center, finances, lack of insurance, all these things have an impact on our health. And this was something that really stood out to me and made me really curious about healthcare in this sense. The other experience that I had while I was enrolled at this school was my experience during an internship, a summer internship that I took over the summer. It was an internship that allowed us to experience different healthcare professions: medicine, dentistry, nursing. Prior to this experience, to tell you the truth, I had no idea about dentistry. I actually had never been to a dentist before. So it was in this experience that I really got to understand the dental profession. And after looking at and watching over the female dentist that was practicing, I thought, this looks like something I could do. So between my experience in the internship and this one class that I took at Bowdoin, and obviously being infused with this sense of offering something good to the world, the common good as we all call it, I had my Superman cape on. I'm ready to jet out and save people's teeth. So there I was out in the world. I went through dental school and basically started the practice of dentistry. Dentistry is not just about teeth, though. It's about our entire oral health. It's about our mouth. It's about our entire orofacial region. It helps us express our smiles. When you have a toothache, as I'm sure many of you have experienced, it is not cool. You may not be able to show up to class or work because of pain in your mouth. Oral health care is so important to me, and yet I feel that it's not talked about enough in the mainstream. We all know the importance of mental health. We all go on diets and exercise because we understand how important it is to keep our bodies healthy. But what about our mouth? What about our teeth? It will be quite a shame to not be able to show up to class or go to work because of a toothache. So I'm on a mission to make sure that oral health care is at the forefront of our discussions, just like all the other professions in healthcare. So currently, I work for 2 nonprofits because I'm that desperate. I work for a community a community health center. It's a federally qualified health center that basically provides services for underserved communities. We have medical doctors in our practice, behavioral health, pharmacy, different divisions of healthcare. And I work there to provide services to these underserved communities. I also work in a mobile dental van, and I go to different schools to make sure that students also have access to oral health care. So while public health dentistry is excellent, it does have its limitations, and those are some of the things I'll be describing today, and some of the ways that I believe we can mitigate some of those barriers. In my practice so far, one of the challenges that I find I run into are time constraints. Unlike private practice, a lot of dentists in private practice are able to offer full dental rehabilitation to a lot of their patients. They can spend an hour or two just with one patient restoring their oral dental health. That is not quite the case in public health dentistry if we're trying to reach a lot more people. And so we have to continue to find ways to be a lot more efficient for us to have the reach that we're looking to have. Another constraint that I feel I've ran into in public health dentistry is the anxiety that comes with dentistry. As a dentist, most of the time when I run into my patients, they usually talk about how young I look, what's going on with my accent, when was the last time that I got out of dental school. But truthfully, the most interesting comment that I get is the one patient that sits in my chair, stares me right in the face, and says, "I hate the dentist. I don't even know why I'm here." And I say, "Okay, that's cool. No beef there, because I understand. I understand that dentistry precedes local anesthesia, so there's a lot of horror stories, even in the movies, about people's experience at the dentist. I understand because when I look on my tray, I just see a handpiece, an anesthesia, maybe a forceps for an extraction. But what a patient sees is a needle, some pliers, and then a high-pitched drill. I get it, because I wouldn't want pliers in my mouth either. I would rather reserve that for a plumber or a mechanic. But that is the nature of our profession. And so these dental fears are real. Some patients may have had these fears due to their childhood experience. Some patients may have had these fears based on their experiences as adults, or guardians that may have had poor dental experience and transferred those fears to their children. There are other people that may have had just distressing experiences in life, unfortunate things like abuse or violence, and may project these fears in the dental arena as well. So these fears are real. And the other barrier that I find that I run into are just the logistics of access to care. Patients that lack transportation, patients that don't have money, lack of insurance, language barriers can all inhibit a patient from getting the dental care that they need. So while I was so excited to fix teeth after I got out of Bowdoin and thinking I'm gonna go out there and just fix all these people's teeth, and I'm working for different offices, I find that there are these very real barriers that really prevent me from being able to see that everyone has access to oral health care. So how do we mitigate some of these challenges? And in my experience so far, I want to talk about the role of the community dental health coordinator. I may abbreviate this sometimes and say CDHC, because try saying community dental health coordinator 10 times, and after a while it just sounds like gibberish. So the community dental health coordinator is a role that was introduced by the American Dental Association in 2006, and it was really meant to mitigate some of these barriers that I just described. In order to be a community dental health coordinator, you could be a dental assistant or a dental hygienist and receive additional certification in this program. The community dental health coordinator basically is just your friend in your dental office. A little removed from the dentist and the dental staff, but their role really is to speak to patients about, access to care, if they're having issues with transportation, if they really need to have a better understanding of their oral health, to help educate them. You can imagine that if you are having fears about going to see the dentist, but you have this other person that was also in your community that can really express to you what takes place at the dentist, maybe give you some recommendations or referrals to where you can get dental treatment from. I think just in that interpersonal connection, that may help reduce some of the fears that patients may experience going to the dentist. So I really want to speak to the role of this community dental health coordinator. Unfortunately, it doesn't have as much as a presence in public health dentistry as I would like to see. But hopefully, as we continue to have conversations about that specific role, it will become more prominent in the dental field. So the dentist and the dental staff are still not exempt to educating their patients, speaking to them, making sure that they also see the importance and relevance of oral health care. And that's not to exempt them from those roles, but especially in public health dentistry, when we're working with such limited time, when there are so many barriers that get in the way of patients gaining access to care, I think that there needs to be an additional role just to help bridge that gap between our dentists and the patients that need the care. So I looked online just to see different community health centers and the ones that incorporate community dental health coordinators into their practice. There's one such healthcare center in New Jersey, and their specific research was based on diabetic patients and seeing the role that CDHC has in improving the oral health of diabetic patients. As I may have mentioned earlier, diabetic patients are more likely to have poor oral health based off of their condition. So it makes it even more important that their oral health is really regulated. And this community dental health center was able to increase the dental treatment among these patients by 40%. So that's 40% of patients that have diabetes that may not have had their oral health taken care of had it not been for the interjection of the community dental health coordinator. The community dental health coordinator is basically almost like a social worker that really helps bridge the gap. And that's just a role that I feel is missing and needs more presence in our field. So to summarize, basically, I know I've been speaking a lot about the role of the community health dental coordinator and how I feel they could have a very great impact in public health dentistry. But truthfully, it's not really about the role. It really is about the point of human connection. And especially in the field of dentistry, which is marred with so much fear and so much anxiety and so many barriers, having that human connection would hopefully help us bridge that gap to really see people get the oral health care that they need. Human connection is so important. Just reflect on your own experience when you've had to make a reservation and you are punching numbers because some machine is telling you press 1, 2, versus actually being able to speak to an agent. Think about how much more effective that is. There's a lot of conversation about trauma-informed care, And I think the community dental health coordinator can really help mitigate some of these fears and anxieties and really talk to people about the fears that they have with being at the dentist. In summary, I really hope that oral health care is at the forefront of our conversations, and we continue to find ways to make sure that oral health care is available to all. Thank you.